Okay, well, thank you for that introduction, Kelly. As she said, I am an intern here at Stronger. My name is Alayna, and today I will be talking to you all about how to better manage your anxiety. So, first of all, not all of our stress is necessarily bad. We do experience both distress and eustress. So, with eustress, this is the type of anxiety or stress that is considered normal or necessary. This is the kind of anxiety that's based on reality. It's necessary for our survival, our optimal functioning, and just overall our well being. So, we may experience eustress when there's some sort of impending danger or something that causes us to need to take action to resolve that issue in order to make sure that we are safe and that we are surviving. So, examples of this would maybe you've lost your job and you have to figure out, how am I going to pay rent? Or you have a big test coming up and you're thinking that you probably should study to prepare for that. Now, on the other hand, we do also experience distress. So, this is anxiety that is not based on reality. This is the type of anxiety that is defeating to us and it keeps us from experiencing our life fully. And this can really severely isolate and limit us. So, some examples of distress would maybe be a fear of flying. So, as we know, air travel is safer than the daily travel that we have in our cars. However, there are still many people that have that fear of flying. Another one is just generally overthinking or only thinking about things in terms of what's the worst case scenario that can happen. Agoraphobia is another example of distress or anxiety that can really isolate or limit us. And for those of you that are not familiar, agoraphobia is the fear of being in situations where escape might be difficult or maybe help is not available. So, someone with agoraphobia may not leave their house very often, if at all, or maybe they avoid public situations or public transportation. So that would be an example of how anxiety could really isolate or limit us and can prevent us from growing as a person or having enriching experiences. So, with anxiety, some of the most common disorders that we see include adjustment disorder and generalized anxiety disorder. So, I'm just going to go through both of these disorders and then make the distinction between the two very clear for you all. So, with adjustment disorder, the DSM, which DSM is a diagnostic and statistical manual of mental disorders, which is essentially just a guide for mental health practitioners such as psychologists, psychiatrists, or therapists. And this tool helps us identify and diagnose mental health conditions. So, with adjustment disorder, the DSM lists three different criteria. So, number one being there has to be an experience of stress due to a stressful life event or events. Number two, there are emotional and behavioral symptoms following that stressful event or events for 3 months or less. And those symptoms might include low mood, anxiety, irritability, and decreased performance at school or at work. And those symptoms are not explained by existing or other mental health conditions or normal grieving. Now, generalized anxiety disorder, or GAD for short, the DSM lists several different criteria for this. Number one being there has to be excessive anxiety and worry about various events that have occurred more days than not for at least 6 months. And someone with GAD finds it difficult to control that worry. The anxiety and worry are also associated with at least three of the following six symptoms: restlessness, feeling on edge, being easily fatigued, having difficulty concentrating, irritability, muscle tension, and sleep disturbance. However, it is important to note that only one symptom is required in children. The anxiety and worry or associated physical symptoms also cause clinically significant distress or impairment in important areas of functioning, such as at school or at work. And that disturbance is not due to the physiological effects of a substance or a medical condition, and it's not better accounted for by another mental disorder. So I know that was a lot of information on those two slides. So I just want to differentiate between those two disorders a little bit more. So with adjustment disorder, this is an emotional or behavioral reaction to stress, while GAD is characterized by persistent worry and anxiety. And GAD can manifest without those identifiable emotional stressors or life events that are causing us stress. So with adjustment disorder, we're looking at symptoms that occur in response to a stressful event or a change, such as maybe a life transition, going to college, for example, or maybe you've lost your job or you've broken up with your significant other. And symptoms may improve as you adapt to that change. Now, with GAD, the symptoms include excessive anxiety and worry about everyday situations. And those symptoms can include physical symptoms such as the sleep disturbance, restlessness, muscle tension, or headaches, for example. And again, that key difference here is that the symptoms are consistent and often not due to a specific event, as they are with adjustment disorder. So I know this slide may be a little bit difficult for you guys to read. It's very small font, but this just further explains that difference with adjustment disorder and generalized anxiety disorder. So just to be clear, adjustment disorder, emotional behavioral symptoms within 3 months of being exposed to a stressor. The cause is an external stressor or life change. And with treatment, usually these symptoms resolve in a matter of months once the individual has adapted to that change or their circumstances have changed. So with treatment, typically we're going to be looking at just therapy, but in less cases, sometimes medication is also involved. With generalized anxiety disorder, we're looking at usually 6 months or more of chronic exaggerated worry and tension that is unfounded. And the causes, this is going to be a combination of genetic, behavioral, and developmental causes. And for treatment with GAD, typically this is going to be present for long periods of time. With that being said, treatment typically involves a combination of therapy and medication. So we're going to watch a short 5-minute video that just further explains generalized anxiety disorder and its causes, symptoms, and treatment.
Say you've got a huge presentation in front of all your colleagues. You're nervous. You've got quite a bit of stress leading up to the presentation. That stress is completely normal and really probably useful in certain situations since it can make you more alert and careful. After the presentation's over, you feel the stress start to fade away, right? Well, for 3% of the population, the stress doesn't go away. And maybe that stress isn't even brought on by a specific event, and it's always just sort of there. Either way, at this point, it's considered to be anxiety. That anxiety might get worse over time and cause things like chest pains or nightmares. Sometimes the anxiety is so severe that it causes someone to be anxious about leaving the house or doing everyday things, like going to work or school. This anxiety might be a sign of generalized anxiety disorder, sometimes shortened to GAD. GAD is characterized by excessive, persistent, and unreasonable anxiety about everyday things like money, family, work, and relationships. Even sometimes the thought of getting through the day causes anxiety. If the anxiety is persistent, then it doesn't seem to go away. If it's excessive, it's usually more than someone else might feel. And if it's unreasonable, they probably shouldn't have a reason to feel anxious about it. People who have GAD might even understand that their anxieties are excessive and unreasonable, but they feel it's out of their control and don't quite know how to stop it. People with severe GAD might be completely debilitated and have trouble with the simplest daily activities, or they might be only mildly affected and might be able to function socially and hold down a job. Sometimes the feelings might worsen or improve over time. In addition to having feelings of worries and anxiety, other symptoms include edginess and restlessness, difficulty concentrating or feeling like the mind just goes blank, and also irritability. And these psychological symptoms can also lead to physical manifestations of symptoms, like digestive problems from eating more or eating less. They might also have muscle aches and soreness from carrying tension in their muscles. Finally, difficulty sleeping is a really common symptom that can have a serious impact on physical well-being since the body's not resting. And this can lead to issues of chronic fatigue. Although the decision that someone's worry is excessive and unreasonable has a subjective quality, diagnosing GAD is aided by the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5. This manual gives a list of criteria to meet in order to be diagnosed with GAD. First, the excessive worry and anxiety has to have been present for more days than not over the course of 6 months. In other words, a person should have the symptoms of excess or unreasonable worry on 90 or more days out of 180 days. Generally, people can't quantify or track their feelings in that way. So again, this is meant to offer a general guideline, right? Okay, second, the person finds it hard to control their anxiety, meaning that they have a hard time calming themselves or self-soothing to help themselves regain control over their feelings. Third, an adult must have 3 or more of the symptoms listed previously. In children, though, typically defined as school age, so between 6 and about 18 years old, only 1 symptom is needed for the diagnosis of GAD. Another criteria is that the anxiety causes impairment in important daily activities like school or work. For example, they might miss deadlines or find it difficult to even go to work because of their symptoms. Fifth, the symptoms are not attributable to the physiologic effects of drugs or medication, or due to a medical condition like hyperthyroidism, which creates an excess of thyroid hormone, which can sometimes cause symptoms of anxiety and worry. Finally, their anxiety isn't better explained by another mental disorder, like social phobia or panic disorder. Just like a lot of other mental disorders, it's unclear exactly why some individuals develop generalized anxiety disorder, but it's thought to be a combination of genetic and environmental factors, as it seems to run in families. It also has been shown to be twice as prevalent in females than in males. Treating GAD, like many mental disorders, may involve psychotherapy, medication, or a combination of the two. If it's psychotherapy, cognitive behavior therapy has been effective since it teaches the patient to think and behave in different ways and react differently to situations that would usually cause anxiety and worry. Medications like benzodiazepines or antidepressants might be prescribed as well. Benzodiazepines are a type of psychoactive drug that have a relaxing and calming effect. Antidepressants might also be prescribed, like selective serotonin reuptake inhibitors, or SSRIs, which regulate the serotonin levels in the brain and help elevate mood. Even though both medications and cognitive behavior therapy have similar effectiveness in the short term, cognitive behavior therapy has major advantages over medication in the long term due to unwanted effects of the medication like tolerance, dependence, and withdrawal.
All right, so I really like that video. I think it gives a lot of great detail and just further explains the causes, symptoms, and treatment. So as the video mentioned, some of those symptoms of anxiety, I'll just quickly go through since we've already heard a little bit about them in the video. So the feelings of nervousness, restlessness, or feeling tense. An individual with anxiety may feel that sense of impending danger, panic, or doom. Maybe they have an increased heart rate or rapid breathing, sweating, trembling. You may feel weak or tired or have trouble concentrating, trouble sleeping, and GI problems, having difficulty controlling the worry, or having the urge to avoid things that trigger anxiety. So now that we have a good understanding of what anxiety can look like, I want to talk a little bit about some of the causes of it. So the first thing being chemical imbalances in our brain. So the imbalances in our brain, typically we're looking at norepinephrine, serotonin, dopamine, and GABA. These are all neurotransmitters, which for those of you that are not familiar, neurotransmitters are chemical substances that transmit signals in our brain across the synapse, which is the gap between two nerve cells or neurons. And these chemicals are released from one neuron and travel to receptors on another neuron, which helps pass those messages that regulate various functions like our mood, movement, sleep, and other bodily processes. And these really play a crucial role in the communication between neurons and can influence everything from our emotions to our physical health. So with anxiety, we're typically looking at norepinephrine and serotonin. And serotonin regulates our mood, sleep, appetite, memory, social behavior, and sexual desire, while norepinephrine plays a crucial role in the body's response to stress, fear, and excitement. So, when levels of certain neurotransmitters, such as serotonin or norepinephrine, are too low or are unbalanced, it can lead to overactive or underactive activity in our brain, which trigger those feelings of worry, anxiety, and fear. So, for example, low serotonin levels can affect our mood regulation, which may make it harder for us to feel calm or happy. And low norepinephrine can reduce the body's ability to effectively respond to stressful situations, which can contribute to anxiety as well. So, these next four bullets here, I am going to talk a little bit more in more detail in some of the upcoming slides, but I just want to give a quick overview of these here as well. So, we're also going to be talking about brain changes and how there is increased amygdala activity in individuals with GAD versus those without or controls. We'll also be talking a little bit about genetics, as the video mentioned, how anxiety disorders tend to run in biological families, environmental factors that contribute to our anxiety, such as severe or long-lasting stress or experiencing a traumatic event, and finally, cognitive distortions, which I'll explain what that is in a later slide. So first off, those brain differences. So this study looks at amygdala activity in patients with GAD. And the amygdala is a part of the brain that's primarily responsible for processing our emotions, specifically fear and anxiety. And it does this by identifying potential threats and triggering that fight or flight response. So this study looked at the amygdala activity in GAD patients, and they did this as they viewed unpleasant versus neutral images. And to give you guys an idea of what that means, the unpleasant images would be a more disturbing or unsettling image, such as human remains, while the neutral image may be something like a lamp or a fire hydrant, for example. So prior to that image presentation, all the participants in the study received a cue predicting whether that image would be unpleasant or neutral. And what they found was that the individuals that participated with GAD, they showed significantly greater amygdala activation on both sides of the brain compared to the healthy controls. And this increased activation was observed during both the adversive or the neutral trials. So as you can see on this bar graph here, the participants with GAD had just about 2 times of the amygdala activation compared to controls that did not have generalized anxiety disorder. So very interesting how there are differences in our brain. Now, genetics of GAD. So GAD is a moderate genetic risk with about 30% of the condition being influenced by genetics. So what this means is that if you have a close biological relative with generalized anxiety disorder, your risk of developing it is higher than someone without that family history. However, genes are not the whole story. The remaining 70% of the risk is likely due to environmental factors, such as life experiences, parenting styles, or personality traits. Now, environmental factors, one of them being trauma. So individuals that have experienced trauma, their brain may be hovering in survival mode, which means that they're always on alert or anticipating the next event. And when you've been through something traumatic, you may have some apprehension about it happening again or re-experiencing that distress, which can result in an increase in our anxiety. So in a typical stress response, our anxiety fades once that threat is gone. However, trauma can prevent this, and it can cause lasting brain changes that keep you in that fight, flight, freeze, or fawn mode. And just to go over this graphic in the right upper hand corner here of that trauma response, with fight, they give the example of maybe you've come into contact with a bear, just for the sake of the example. With fight, you would fight the bear or verbally or physically attack the threat. With fawn, you would keep the bear happy or do whatever it takes to avoid or diffuse the danger of the threat. With freeze, maybe you would play dead, or with freeze, our body might shut down. We may not have the ability to think or speak. And with flight, we would run away from the bear or remove ourselves from the situation with the threat. So, other environmental factors that may contribute to our anxiety. Being in a stressful environment all the time continuously also can activate this fight, flight, freeze, or fawn mode. So, examples of stressful environments, maybe you work a demanding job with tight deadlines or have a chaotic family dynamic with frequent conflict, experiencing financial hardship or living in a high crime area, dealing with chronic illness. These are all examples of those stressful environments that may trigger this trauma response. So the video briefly went over what cognitive behavioral therapy is, also known as CBT. So CBT is based on the idea that how people think about situations can affect their feelings and behaviors. And it operates under the notion that our thoughts, feelings, and behaviors are all connected. So with CBT, one of the things that we do is look at, identify, and challenge cognitive distortions, which are faulty or inaccurate thinking, perceptions, or beliefs. So with CBT, we want to identify those negative thoughts and replace them with more positive ones. So I'm going to go through several examples of what cognitive distortions may look like. And there are quite a few, so just bear with me. So first off, black and white or all or nothing thinking. So with this type of thinking, maybe you're thinking or you're saying to yourself that I never have anything interesting to say. This type of thinking doesn't leave any room for what we call shades of gray or middle ground thinking. And shades of gray, that allows us to recognize things are rarely all good or all bad. It looks for those multiple perspectives and those possibilities in between. Another one is jumping to conclusions or mind reading. So maybe thinking to yourself, the doctor's going to tell me I have cancer at my appointment today. This is assuming something without any evidence. Personalization is another one. So maybe saying our team lost because of me. With this type of thinking, you're not accounting for any other factors that may have contributed to that outcome. So maybe with that statement of our team lost because of me, you're not acknowledging the fact that there was snow on the ground or that half the team was injured. Shoulding or musting is another one. This type of language is really self-critical and puts a lot of pressure on you. So maybe thinking or saying something like, I should be losing weight, or I must work out 5 times a week in order to be healthy. So again, this really puts those harsh expectations of ourselves. Mental filter. So this is when we're focusing more on the negative, such as one aspect of a health change which you didn't do well, for example. So saying something like, I'm terrible at getting enough sleep, without looking at all the aspects that you are doing well in that health journey, maybe eating healthy, walking daily, practicing mindfulness. So with this, you're filtering out all those positives and only focusing on that one negative aspect that you still have a little bit of work to do with. And overgeneralization. So the statement of, I'll never find a partner. Maybe the last date you went on did not go very well, but now you're taking that one experience and generalizing it to the overall big picture of never finding a partner. So a few more of these for you all. Magnification and minimization. So with this, we're magnifying the negative, minimizing the positive, saying something like, it was just one healthy meal. This type of thinking really prevents us from fully acknowledging any progress that we've made or how we've achieved our goals. Fortune telling, this one's very similar to the mind reading one. So saying something like, my cholesterol is going to be sky high at my doctor appointment. Again, this is assuming the outcome without really knowing the facts. Comparison. So maybe we're looking at our coworkers and thinking that they're all happier than us, or that our coworkers are all smarter than us, or better at our job. Again, this is another example of we're assuming things without knowing, and we don't know the true experience of others. Catastrophizing, this one is really just thinking about things in the worst case scenario. So maybe you find a spot on your skin and you're thinking to yourself, this must be skin cancer. I'll probably be dead soon. So we're definitely making that situation out to be way more than it is and thinking about only that worst case scenario. Labeling, so saying something like, I'm just not a healthy person. With this type of thinking, we really stamp ourselves with an identity and a label, which can limit us from trying new things. Saying something like, I'm just not a healthy person would likely limit you from trying new healthy foods or trying a new workout, for example. And finally, disqualifying the positive. So saying something like, I answered that question well, but it was a lucky guess. With this, we're not giving ourselves credit where credit is due. So how can we challenge all these types of cognitive distortions? The first step that we want to take is identify those thoughts as unhelpful. We want to catch ourselves in these and notice them as irrational. The next step we want to do is gather the evidence. So, what evidence is there to support that thought or that belief? So, some of the questions you might ask yourself maybe, is this thought helpful? Am I making assumptions? Can I look for those shades of gray or that middle ground thinking? Are there any exceptions to those absolutes, those always and never in my thoughts? And then number three, we want to develop balanced thoughts and reframe that thinking, create those alternative rational responses. So, an example of this, maybe our negative thought is, I always mess things up. Our reframe thought might look something like, I've made mistakes in the past, but those mistakes don't define me. I can learn from them and do better next time. So I just wanted to include these two worksheets or exercises that I often use with my clients. And I find these really helpful in challenging these anxious or negative thoughts and trying to see some of those other perspectives. So this one on the left with challenging anxious thoughts, one thing we might do is describe a situation or event that commonly triggers your anxiety. Then we would look at, what's the worst outcome, the best outcome, or the likely outcome. Assuming that the worst outcome happens, would it matter a week from now, a month from now, or a year from now? And then the bottom part of that worksheet would be writing out that first irrational or automatic thought, and then writing out the rational thought. So what's the thought that we've reframed after going through that? On the right side here, the challenging negative thoughts worksheet, some of those questions that I just previously mentioned that we can run through and check in with ourselves to see if these thoughts are irrational or rational. So maybe, is there evidence for this? What's the evidence against this thought? Am I attempting to interpret the situation without all the evidence? What would a friend think about this situation? I personally love that one. I think it allows ourselves to give ourselves some compassion, show ourselves some grace in a lot of situations when we have those harsh expectations of ourselves. And if I look at the situation positively, how is it different? And then again, that similar question from the previous worksheet, will this matter a year from now? How about 5 years from now? So I think that these activities really allow us to start to challenge these thoughts and allow us to see some different perspectives. So similarly, this thought stopping technique is pretty much the same as the identify the thought, challenge it, and reframe. Just adds in another tactic of imagining this stop sign. So with number one or first step, you would be noticing that thought. Step two would be, picture a stop sign in your head or say stop to yourself, then challenge that thought and reframe. So this middle worksheet says catch it, check it, change it. Easy way to remember of how to identify those thoughts and challenge them. So the next thing that I want to talk about is mindfulness. So mindfulness is all about focusing on concrete things that you can experience with your senses. So our sight, sound, touch, smell, and taste. And this shifts our focus away from those anxious thoughts that we're having and onto something more concrete and present in the moment. So I'm going to go through 10 mindfulness exercises that you guys can try or look into. Number one being mindfulness meditation. So I know the word meditation might be a little bit intimidating, at least it was for me. I always picture someone, sitting for several hours at a time, but meditation, it really can be any amount of time from just a couple of minutes to whatever feels comfortable for you. And this is all about focusing your attention on your breath, noticing that full inhale and exhale. And this can really help reduce our stress and make us feel more calm and also improve our focus and attention. Number two, setting mindful intentions. So with this, we want to set clear and concise goals for ourselves. So for example, saying something like, I intend to treat myself with self-compassion today, or today I will focus on the things that I'm grateful for, or maybe I'll approach challenges with an open mind. Number three, observing anxious, negative thoughts drifting away. So with this one, maybe you can visualize your thoughts floating past you on a cloud or down a stream, or maybe slipping off your shoulders. I like this one because I think it helps remind us that we are not our thoughts and those thoughts don't define us. Another one is grounding exercises. So with this, we want to stimulate those five senses. This can help us remember and connect with where we are, give us a better sense of control when we're feeling out of control. One of the most common grounding exercises you may have heard of is the 5-4-3-2-1 activity. So that's 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Depending on where you are, the taste one might be a little bit more difficult, but some people may find it helpful to put a mint in or a piece of gum, or maybe have a really cold sip of water. And number 5, mindful breath work. So breath work can help calm the systems down in our body, can help reduce our heart rate, our blood pressure, and overall those feelings of anxiety. There are several different types of breath work techniques that you can do, one of them being box breathing, which it's inhaling through the nose for 4 seconds, holding the breath for 4, exhaling through the mouth for 4, and then holding your breath again for another 4 before restarting. So you can draw a box as you do that if that helps you. Another one is 4-7-8 breathing. So this is inhaling through the nose for 4, holding the breath for 7, and then exhaling through the mouth for 8. And this is something that you can repeat depending on what feels good for you. So another mindfulness exercise is body scan and progressive muscle relaxation, or PMR for short. This is a technique where you systematically tense and then relax different muscle groups in the body, which can help reduce our stress and promote relaxation. So you would start this by tensing a muscle group, and some people find it helpful to maybe start at the top of your body or the bottom. So for example, starting with your feet or starting with your fists and tensing those for 5 to 10 seconds. And then you would release that tension suddenly for about 20 to 30 seconds. By repeating that process, you help your body recognize that difference between tension and relaxation, which again can help us feel a little bit more calm and reduce our anxiety. There's also a ton of tutorials on this on YouTube or Spotify, which can make it really helpful to do this at home, especially if you've never done this before or are not familiar. Number 7, taking a mindful walk. So I think that walking outside, just taking a second to connect with nature, connect with your body, feel the sun on your skin or the wind in your hair can help us connect back to the present moment. Focusing on one thing at a time. For a lot of people with anxiety or that are more type A or like to plan, a lot of times we might catch ourselves in planning ahead for something months away and worrying about things that are months away. So sometimes it's helpful to bring ourselves back to the present moment, focus on what's important today or tonight. And number 9, journaling. So I'll talk a little bit more about journaling in one of the upcoming slides, but just to go over it briefly here. With journaling, it's all about putting those thoughts and our feelings onto paper, which can help us reflect and reframe some of those thoughts that we're having and see those different perspectives. And number 10, spending intentional time without your phone. This, of course, can be really challenging, especially in the world that we live in today, but sometimes it can be helpful to give ourselves a break from content that may or may not be affecting us in ways that we might not even understand. For example, sometimes the things that we see in media can be harmful to us and can contribute to overly high expectations. So some natural ways to reduce our anxiety. I'm sure you all have heard the first one before of staying active, but exercise does divert our attention away from those thoughts, and getting our heart rate up also generates changes in our brain chemistry, including those anti-anxiety neurotransmitters that we talked about earlier. Limiting alcohol intake is another one, just due to drinking high amounts of alcohol may interfere with those neurotransmitters as well that are involved in regulating our mood. And similarly, stopping tobacco use, as nicotine and other chemicals that are in cigarette smoke do alter those pathways in our brain as well. Limiting caffeine intake. So caffeine does have the ability to increase our anxiety or our risk of panic attacks. So something to be aware of if you are a coffee drinker or drink any types of energy drinks or anything like that. And another one you've probably heard before, prioritizing adequate sleep. So the CDC does recommend at least 7 hours a night, and eating a nutrient-dense diet. So we want to make sure we're trying to stay hydrated, eliminating processed foods, and eating a balanced diet, as that can also help alleviate anxiety symptoms. And lastly, practicing deep breathing. So again, that deliberate process of taking those slow, even breaths can help restore the regular breathing patterns and reduce those anxiety symptoms in the moment. All right, so jumping back just for a moment on journaling. So journaling has been linked to decreased mental health stress, and it can help us prevent from ruminating on some of those negative thoughts and just overall create that awareness of putting our experiences into words, which can help understand our emotions better, regulate them, and form those new perspectives. So one thing I just wanted to share with you all was the 5-minute journal, and not necessarily the journal itself, but the prompts that the journal gives. This is something that I recommend to someone that has not journaled before. This is actually something that I utilize daily, and it's really helped me in my own anxiety journey throughout the years. And I just bought my second one, so I'm really benefiting from it, and I often recommend it to my clients that are looking just for a quick and easy way to implement journaling. This is something that only takes a couple minutes a day, so I think it's good for someone that might feel a little overwhelmed by the idea of setting aside time to journal. So the prompts, the morning ones are, what are 3 things that I'm grateful for? What are 3 things that would make today great? And then a daily affirmation. And then the evening portion, which is that bottom darker half of the page, you come back at night and just typically before bed or whenever works for you, you would reflect and say, what were the 3 highlights of my day and what did I learn today? So I think these prompts are great for setting those mindful intentions of the day of, maybe that affirmation that you write is, I'm going to treat myself with compassion today, or I'm going to have a positive mindset about the challenge that I have today. So really love those prompts, often recommend them to clients, especially for someone that has not journaled before. So if you're a reader, I just wanted to include a couple of books here that are focusing on understanding our anxiety triggers, challenging those anxious thoughts, building resilience, and learning techniques for just managing those difficult emotions that we experience. So these 3 books are really designed to equip readers with tools to improve their mental health and navigate life's challenges. So the ones I put on here are Why Has Nobody Told Me This Before?, Unwinding Anxiety, and Rewire Your Anxious Brain. So this is something you could utilize as either reading or maybe on Audible if that's more your thing, but those are some resources if you're a reader. I also just wanted to share a couple of podcast resources with you all. So the ones I included on here, Your Anxiety Toolkit, The Calmer You, The Anxiety Coaches, Anxiety Slayer, and Meditation Minis. I will say The Calmer You is my personal favorite. She's such a calming voice and she's very authentic. And some of the, episodes or examples of what these podcasts would talk about, maybe a topic of how to care less what people think, or dealing with what if thinking, self-care tips for anxiety relief, or how to understand your people-pleasing tendencies or those harsh expectations that you set for yourself. The meditation minis one is a good one for if you're looking for guided breathing practices or guided meditation. So I find these super helpful. I think that these are something easy that you can just put in while you're driving in your car or running errands, easy way to implement some positive mindset. So I'm going to talk about just the medication options for anxiety that are, I want to throw that disclaimer out there of to always consult with your doctor or psychiatrist about treatment options if you're considering medication. So just to explain what these are. So the drug classes of selective serotonin reuptake inhibitors, or SSRIs, and serotonin or epinephrine reuptake inhibitors have generally been considered part of the first line pharmacotherapies for GAD. So serotonin, to review, that is what regulates our mood, our sleep, appetite, memory, social behavior, and sexual desire, while norepinephrine plays a crucial role in our response to stress, fear, and excitement. So with SSRIs, they block the reabsorption of serotonin, which makes it more available to pass those messages between brain cells, which improves our overall mood. Now, SNRIs block the reabsorption of both serotonin and norepinephrine, which makes both of those more available to pass messages between brain cells, improving overall mood. Now, the choice between SSRIs and SNRIs for treating anxiety depends on a variety of factors. So, including the individual's specific symptoms, the body's response to the medication, and any other underlying conditions. So, for example, SNRIs may be prescribed if the individual has symptoms of depression as well, such as physical symptoms like low energy, fatigue, difficulty concentrating, since norepinephrine plays a role in physical energy and alertness. It's also important to note that antidepressants do take several weeks to take effect, and to always consult with your doctor or psychiatrist. I also just want to mention that our team of therapists here at Stronger support our clients when considering medication as a part of their treatment plan. And this can be helpful in reducing some of that stress or not knowing where to start. And we do have established relationships with providers we collaborate with, and we can always help in that referral or recommendation process as needed. So that concludes the informational portion of the presentation. I just want to encourage you all to stay in touch with us here at Stronger. And also just want to shout out Lisa, our intake coordinator, who is always so helpful in connecting individuals to the right therapist for them, and is also happy to share any local resources with clients if we are not able to support them. And the last thing I'll mention today is our Brave and Strong financial assistance program. So here at Stronger, we are extremely passionate about our Brave and Strong financial program, which allows individuals who are experiencing financial hardship to acquire and maintain mental health services. And in 2024, we were able to raise $3,600 with the help of our program partners. And over the past 4 years, we've been able to directly support more than 42 individuals who have either had the inability to begin services or had to consider pausing existing treatment due to financial hardship. So with that being said, this webinar today is free, of course, but if you'd like to donate to our Brave and Strong campaign or buy a t-shirt, I'll have all the links on this slide for you guys, and we would so appreciate it. So at this time, I'll open it up for any questions you guys may have. You can throw them in the chat if you'd like.
Well done, Alayna. We want to thank you so much for all of your work in preparing this presentation with us and sharing all this information and helpful resources and tools. I feel like I was even impressed with some of the resources and want to dig back in myself. So thank you so much for sharing all of that with us. And thank you also to Gina. Gina is Alayna's supervisor as an intern with us here at Stronger. And before we had started this recording, we shared that we are grateful and lucky to have Alayna joining us as a full-time therapist starting in June. So you'll be seeing her around more frequently. Thanks again for everyone attending, and we hope to stay in touch and see you soon. Thanks, Alayna. Thanks, Gina.
Yes, thank you all for attending, and don't hesitate to reach out with any further questions. Thank you. Okay. All right, I just stopped the recording, I think.
Okay, and then it's going to prompt you if you want to email